There it goes. All right, so the Affordable Care Act. Anybody want to start us off?
I guess just see, hang on one second. Let me see what she discuss your thoughts and feelings on it, discuss the impact of on health insurance companies, providers, and patients. So I guess did you guys look up at why it was created?
Yeah, I kind of got like just the main goal was to ensure that every American could afford at least some sort of type of health insurance act.
Okay. Let's see. Rhonda, what about you?
That was the same thing. I had pulled up some internet. The law had three primary goals: to make affordable health insurance available to more people, to expand the Medicaid program to cover all adults below a certain income, and to support innovative medical care delivery methods to lower cost of healthcare generally. And that was off of hhs.gov, and I can share that link.
Yeah,
Maybe.
I know one of the big things it did is it took away pre-existing conditions.
Yes.
I think that was another goal of it.
And then I was like watching one of the supplement videos, and I was talking about how like the Affordable Care Act like mandated insurance companies to provide like a minimum threshold claim, and if it like the claim goes below that threshold, then they have to like rebate back like a little of that premium.
Yeah, that seemed like to be the biggest impact from what I was reading on the actual health insurers, on the payers, was the fact that they had to keep that 80-85% threshold.
Mm-hmm.
And it's like,
go ahead.
Oh, I'm sorry. It's like the large businesses had to have like 85 and then the small was 80, if I remember correctly.
Yes, that's correct.
Yep.
And it created, I know another thing the ACA did was created the marketplace, the shared marketplace, which in some aspects was wonderful, and then in other aspects was a disaster, I think.
Yeah. Yep. I went through that whole marketplace for a long time to get health insurance. So
yeah. And you know, I remember working in healthcare when that first was out, and so many people were using it, and there were so many different options on there. And then like in the next year or two, there was like one insurance you could choose from on there. I don't know if you experienced that same thing actually using it, but
yeah, it was well, I used it for I think like 2-3 years, and then I had gotten back into EMS, and so then but I didn't go full time, and then my next time I went to get insurance, it's going to cost me like $1,200-$1,300 a month.
Wow.
Because of how much money I was making.
wow.
So
Crazy.
So I went full time and been full time since.
I've been fortunate enough that my husband's a retired veteran, so we've got the VA insurance and TRICARE. But I see a lot of struggles from other people. My brother owns a small business, and I know he was really concerned about it when it first came out because of the requirements that it did lay on small businesses to have to provide insurance, and it was really a financial burden.
What was it? More than 12 people? It was something like that.
Over 15.
12, 15, yeah. And that's just basing off, I'm just trying to remember from memory on that one.
Yeah, I think the concept of everything was very much needed, but I just don't know that they'll ever come to an agreement on how to best serve everybody. And, the insurances be able to function as well.
Yeah.
I did look into like how it would affect physicians. And
Uh-huh.
then so where is it? Doctors who achieve the best outcomes with the lowest total insured and patient spending, including spending for services such as hospitalization and drugs, will be paid more favorably than other physicians. So I guess like physicians will benefit off the Affordable Healthcare Act.
Yeah.
And then hopefully patients would too.
I think just from personal experience, and I don't have any written proof behind it, but I worked in a medical office, and I think the biggest impact on us was all of the variations. I mean, there was nothing standard across the board, and it was so hard to figure out who had what and what people were covered by what, and people didn't understand their coverage, and it was very confusing, especially in the first year or so. I think that has kind of straightened out a little bit. Seeing the HMOs go away, that has been a big part, I think, of the ACA, is a lot more are PPOs, and
There's a lot more PPOs and
yeah, it
stuff.
seems to be a more of an option than the HMOs anymore.
Yeah. I grew up in California with Kaiser.
Oh yeah, yeah.
I wasn't a Kaiser patient, but I transported to and from Kaiser all the time.
All right.
So yeah.
Another thing, big impact specifically on the payers was, and it talks about a lot in this chapter, is the requirement that they had to take. I mean, they really couldn't turn anybody away if they wanted the insurance. And the risk pools, the way that made it so unaffordable for the healthy people to not, and then they'll drop out, and then you've got all these high risk patients that are expensive users of the system, and you're paying out all that money on them, and
Yeah.
it's quite a balancing act.
Yeah. I know one thing it did affect with the patients is not really on the health insurance side, was that there was that penalty if they didn't have health insurance.
Yeah. Forgot about that.
It was a tax penalty. And so you either had to have insurance or pay the penalty. And my understanding is that the penalty was pretty harsh.
I love that you guys have all this experience, because I was way too little to even understand at the time.
I don't know about everybody else, but I'm old.
I'm old too. Yeah.
Well, I also found that along with reducing costs, it improve the efficiency of healthcare. And I'm assuming that ties back to how like the providers will get like more money if they like do it on a more like reducer cost, if that makes sense. Like
Increasing the provider's reimbursement based on their
performance
output. Performance, that's good.
Another thing that like affected patients was with that getting rid of the pre-existing conditions. That made it easier for patients to not only get care, but get care for their pre-existing condition.
Yes.
I know I had ankle surgery before the Affordable Health Care Act came in to play, and I had pre-certification on the surgery, and then they came back after the surgery, the insurance company did, and said, this is pre-existing, we're not going to cover it.
Oh,
Yeah,
bad.
my
Yeah.
mom soon has to have like back surgery, and like we were talking about it, like how, I mean, people who need insurance for like care, like obviously they're gonna have something wrong. They're not just gonna go out and be like, hey, I need insurance for no reason. Like they're gonna go out and be like, hey, I need insurance because like there's something wrong with me and I need it taken care of.
Mhm. Yeah, it also got rid of all the if you did get insurance, like private insurance, you had to go through medical testing. They
Right.
required blood work, they required doctor's physical from a doctor of their choosing. Some insurance companies did, so
It also provided wellness provisions, which
yes.
that across the board, I think that has been a big benefit. Very, very good.
Yeah, you don't pay for the wellness exams.
Right.
Mm.
And I was surprised to read in there that the wellness exams, where did I read that? Something about the wellness part of it was not part of that. Oh, wow. Never mind, because I just lost my train of thought. Oh, on page 160 says the only activities performed by a payer that do not count against the MLR, which is the that medical loss rate, are for wellness and prevention and for quality management.
Mhm.
So
Well, did you guys look into like there was so like
have we
okay,
froze?
no.
I don't think
So then I think we already talked about this. Correct me if I'm wrong. I can't quite recall. We talked about the Medicaid Expansion Act. Did we? I thought that was brought up.
no.
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 So sorry, I had just like I have it right here now. I'm just like, oh, I forgot what it said. So it just basically expanded Medicaid, especially because it made it more like people could qualify it for it better. So it just kind of like lowered the requirements, if what I'm saying makes any sense.
Yeah.
Was that also when, if I'm thinking correctly, that is what created these other health plans that are like a Medicaid managed care, like home state
Oh,
health.
like
Oh,
Medicaid or Medicare Advantage
Yeah, only on the Medicaid side.
side.
I think that was a product of the ACA, and that served to help take some of the burden off the actual state paying out the Medicaid funds and such. So I think that was a benefit for the state, because then the insurances took the risk, the home state health and those providers. And same thing with the Medicare Advantage plans too.
Mm-hmm. I know. So like my daughter was NICU and everything, and she almost qualified for Medicaid till she was 18 because of her birth weight. So that she actually dropped below it during NICU, but it doesn't matter. It's on birth weight. So
Interesting.
Hmm. And then, so wasn't there a thing where like it like expanded the open enrollment, or there's just like an open enrollment every year for it, and people can either like buy or switch their insurance and stuff like that, and like the
yeah,
kind of affected that.
Yeah.
yeah. I believe it's October that's open enrollment to start up into January.
And I think I think I'm with you on that, that initially it was longer than that.
Mm-hmm.
And then as people have gotten used to it, that they've narrowed it down to just those few months, but I don't remember where I read that.
Yeah, okay, thank you. So it wasn't just me. I was like, I could have swore somewhere I read that it
Yeah.
affected the enrollment. Well, I'm assuming there's also going to be like cons to this, like it already insured people increase their premium. Taxes were created to help supplement the ACA, including taxes on medical equipment. And then like, oh, here's one. Businesses like cut down on employees' hours to like avoid providing like medical insurance and stuff like that. Because with like any employment, like you have to work 8 hours if you want like insurance.
Yeah,
Right.
I was part of that. The job I was working at.
Oh, that's right. You said you had to go like full time to be able to.
Well, no, the job I was a director at a gymnastics facility.
Oh.
And I had to track my hours because I could not go over 30 hours a week, or else they'd have to put me on with health insurance.
Interesting.
So, but I found the federal open enrollment period for 2013 is November 1st through January 15th. So it is several months.
So it is now currently open.
Yep.
All right. Well, did you guys look into it? Also said to like discuss jobs in healthcare fields. Did you guys look into any of those?
Yeah, I don't want to do health insurance and health.
I wouldn't either.
I think about the only thing I could do the health insurance would be actually processing the claims or like denying them or going through
Like,
with a fine tooth comb.
Let's see. I wrote some down, like the medical insurance claim specialist.
Yes. Yeah.
And then there's the billing specialist, and then there's the underwriters, insurance underwriters.
Mhm.
Oh no.
I would not want to do financing. I would not want to do sales. I would not want to do marketing.
Oh no, absolutely not.
We have changed the way we do health insurance at my work right now. So as a paramedic, I no longer even have to ask to see their insurance card. I no longer have to ask for any kind of health insurance information from them.
Really?
Yep. We get a face sheet from the hospital, and it has their medical record number on there, and we put that into our chart, and our billing department goes in and pulls their health insurance information from the hospitals.
Wow.
Wow.
That
So
is interesting.
it has actually made my job a little bit easier because people are always like, oh well, you just want me to go to the hospital so you can get money.
Yeah.
Now I'll flat out tell them I don't even want your health insurance information. Now granted, we will bill you, we will
Right.
bill your insurance down the line, but right now I don't care about that. I care about you. And that has actually helped our credibility, as
Oh, yeah.
we're just not there for the money.
Right.
Well, and how many people don't really know what their insurance is anyway, or and then in a crisis situation, it's so much harder to even function. So that's really interesting. I didn't know that.
Well, and it's like, so I live in Christian County and I pay Christian County Ambulance District taxes. And so I get a discount on my bill My daughter has actually been transported by one of our ambulances. And it was $70 for the entire ride
Wow.
because of the discount. And so I'm just like, I'm so glad I don't have to deal with that billing stuff anymore.
Now on the ambulances, are there like contracted insurances with it? I mean, there's
No,
nothing like that. is there?
because it's not contracted because nobody can, like, so Cox covers Christian County.
Uh-huh.
The patients do not have a choice between Cox or Mercy.
Gotcha.
And so that's how, and we're actually technically not under any kind of healthcare laws. We're actually under Department of Transportation laws.
Oh, I did not realize that either.
So I am, all sense and purposes, a healthcare employee, or healthcare provider, but I'm also not a healthcare provider.
Huh.
We're part of, we do all of our laws and everything go through Department of Transportation.
That is interesting. I really did not know that.
Yeah. Nope.
So I wonder how the helicopters, if they are,
They're the same thing. They're considered first responders. So, yeah.
Yeah, I can't even imagine like showing up to scene and over a big situation. It's like, oh, I need your health insurance. Like
I was
like
thinking the
something
same thing.
super serious. Like,
Mhm. Yeah, like I said, it has made my job easier that they no longer require us to do that.
that.
And when I train new people who have worked in the field before, like they're new to us, they're not new to the field, and I tell them that they do not have to get health insurance information, they are just like, oh, like, yeah.
I bet. Like, I can't even imagine even being like in the patient's shoes, like maybe in like so much pain. It could be something super critical. And it's like, oh, by the way, what's your health insurance? Or I need your health insurance.
Yeah.
Oh,
Yeah.
wow.
And it's moved it from people who are not even trained on what the numbers mean on the card to somebody who is a billing specialist.
Exactly. Yes.
So
Yeah.
it has made a difference.
So did you say, is that particular to where you work, or is that a
Nope.
statewide thing, or?
Nope, that is particular to where I work.
Wow.
So, yep.
We need to start a campaign.
A lot of what Cox EMS is doing is getting recognized nationwide right now.
Really?
Wow.
Wow.
Yeah.
Awesome.
We're doing a lot of really good things that people are starting to take notice nationwide.
Now,
So.
you probably said this, and maybe I'm really bad about missing things. But so is that just like Cox EMS, or is that like Greene County in general, or like Missouri in general?
It's
like paramedics.
It's Cox EMS.
Okay, so like if you get like, I don't know, paramedic from Christian County or something, they probably will still ask for the insurance or whatever.
No, because they're still Cox. Like if it says Cox on the side of the ambulance, any
So
place.
Sorry, I should have, right, you said Christian County is covered by Cox. So if it was like a Mercy paramedic, whatever.
They'll probably be asking for insurance. Yeah.
Wow.
I don't know. I've never worked for them, but that's what I believe they're.
Yeah.
So.
Rhonda, you're right. I wonder if there's like
Yeah.
a way to like just go around and campaign this, like, hey.
Yeah, we do. Yeah.
Do something a little better.
Yeah.
And it's amazing. You would think with all the automation out there and all the electronic health records that it would be easier to get that kind of information, but it is not. It's such a hassle to try to get insurance information.
Yeah. Yep. So I know our Cox Health face sheets, they don't even list the health insurance, like when we bring them into the emergency room and they print out their initial face sheet, it will not have any kind of insurance information, and they will not give out insurance information until that patient sees a doctor and then they'll go and gather the insurance information. And that's an EMTALA thing though.
Gotcha.
So,
Interesting.
because it's that whole, we offer services regardless of ability to pay.
Right. That's awesome.
Well, did we hit all what she wanted to?
Yeah,
ask?
I think so. And then now Zoom is telling me we have like 6 minutes left. So
Hey,
does anyone else have any like last minute thing to add?
Um,
I like your cat.
Yeah, she kind of snuck in, sitting in the background, grooming herself.
Typical cat has to be
I know.
center of attention.
I heard the door creak and she just kind of walking in. I was like, okay, well, shut the world away, I guess.
yeah,
So enjoy her grooming herself.
yeah,
Beautiful.
yeah.
Yeah, I don't know.
That's
Yeah.
really all I had. I mean,
Yeah.
I had the same 3 primary goals as Rhonda, so I saw that website too.
Yeah. Alrighty. Well,
Okay. I will quit the Zoom or the recording then.